I think it's neutral, because we did what we had to do.
Okay, good.
And,
And then there's more after that that you saw there. Not just the child's jaw, you saw other things, which you briefly mentioned.
well, the one thing about knowing about these stressors is that we know not to stare at it, you know.
Uh-huh,
Because we know that it's not good to have those images in your mind. So
yeah.
some people are actually taking pictures,
Uh-huh,
and I knew better than to do that.
yes.
But when you look at the bodies, you can tell that they died in a lot of tremendous pain.
Okay,
You
so
know.
I want you to pick one that you still remember. You got it? What are you feeling in your body?
I feel okay.
You feel okay?
I feel okay.
A 0?
Yeah.
Really?
Yes, because the only thing that I feel right now is sadness.
Okay. Okay. All right.
Mm.
Okay. Even though I feel the sadness,
Even though I feel the sadness,
I honor and respect myself.
I honor and respect myself.
Even though I'm feeling sadness,
Even though I'm feeling sadness,
I honor and respect myself.
I honor and respect myself.
Even though I'm feeling sadness,
Even though I'm feeling sadness,
I honor and respect myself.
I honor and respect myself.
Good. Feeling the sadness,
Feeling sadness,
this feeling of 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 sadness.
this feeling of sadness.
Good. Take a deep breath. All right. 0 to 10 on the sadness.
Mhm.
0 to 10 on the sadness now.
I don't know. I think I think that I just had to do what I had to do.
Right.
So I think that's it.
Okay. So, remembering what you had to do, and I had you focus on one. You said there were people there who obviously died in some pain, and I asked you to focus on one. Is the feeling of sadness gone, or is it still there?
I think the sadness will always be there.
Okay. All right. Because.
Because it was such a horrific death.
Okay. So there's sadness because a tragic event happened, and then there's the intense body-mind reaction, intensity that's there that doesn't serve us to carry, doesn't. So I'm just asking.
That intensity is lower.
Is lower.
Yes.
Okay, good. And give me 0 to 10 or low, medium, high on the intensity.
I think right now it feels low.
It feels low?
Yes.
Okay. Okay.
I think right now I feel like I can accept it better.
Okay. Okay. One final little test for me. I want you to go through the movie again, just from the very beginning, from the Naval Hospital, just to see if anything else pops up that we can just clear while you're here, get rid of it. Make sure that you're pretty low.
From the debriefing, we got into our vehicles. We came to the site, and we looked at all of the debris, tail of the plane. And we were giving bags to pick up body parts. And out of all the parts that I picked up, the only one that I really remember is the jaw of the shark.
Okay. Still low?
Well, you know, I feel that I'm like at a 3.
Okay.
I think that it's good to be able to talk about it, because I don't think I've talked about this in a long time. And it's really good to be in a supportive environment. And that means a lot. And I think that if, in the future, if I ever felt frustrated or if I ever felt sad about it again, I know who I can talk to. But right now I feel more, I feel like I have some hands that have been around me.
Okay, good. So I wouldn't be doing you a disservice if I let you walk out that door as a 3. And so I'm going to ask you to just hold on a little bit longer, and we're going to try to get that 3 down a little bit more.
I think a 3 is good. I think that's pretty good.
Okay. So let's do, just humor me, okay? Even though I'm not done with this yet. I know who to call. And I'm feeling pretty good about it. Even though I'm not done with this yet. There might be a little more to do. But I'm feeling pretty good about stopping here. Even though there might be a little more to do. I know who to call. There's a room full of people to call. And I'm okay with it. I'm okay with it. Even though there might be a little bit more. I'm okay with it. Right now I'm okay. My book 3 is pretty good. Even though Lena says it's not. I think it's pretty good. And I think I can stop right here. Knowing that I might have more work to do. And I have a room full of people that can help me out. Thank you, dear. Okay, thank you so much, James. All right, questions? Yes.
Now, you were doing it less specifically originally, and you got 2, and you said I said something more, and then you began the, from before, the traumatic memories, and worked it very specifically.
Yeah, that's the movie or tell the story technique is you have your client come up with a title for the event. The first part is you make sure that the event is short. Because if it's longer than just a few minutes or 10 minutes long, you will be doing this for a very long time. So that's the first part, is ask them how long it would last in real time. And if it does last longer, then you just say, well, can we do a part 1, part 2, part 3, part 4? I want you to pick part 1 to start on. Have them create a title and tap on the title I know it's global, it's not specific, that's the exception to the rule, is to start bringing the intensity down right away before we even get into it.
I see. So as you were demonstrating the tell the story technique, even if you had gone to 0 on that first part, just
the title.
On the title,
yes,
you would have gone on to tell the story.
Absolutely.
Okay. I was trained in EMDR.
Yes.
And did that work for quite a few years. one of the things, I was very interested to hear you say about, you know, just tapping, you know, without or just tapping on the physical, you know, is going to
Yes.
in. And some of the training I got was, you know, be careful about re-traumatizing by re-exposing to the event.
That's right.
And this was a very impressive piece of work, and I really appreciated how James's comments changed and became much more cognitive. He seemed to be much more right brain as the work progressed.
Yes.
And yet I had this little worry inside of me about you know, too much exposure.
Yes, but you're not just talking about it and reactivating it, you're actually adding the stimulation, which is clearing it simultaneously. That's the piece, right? And then the trauma pull is happening where people want to, you know, the trauma, I'm sure you talked about the trauma pull. He wanted to go there. He was wanting to do things like faster and get into things, and I was, your job is really to slow them down and slow them down and slow them down. So yeah, did I answer your question?
Yes.
Okay. Okay. Yes.
I feel there was and always is this pressure for the, I don't know what you call them, the person tapping to say it's reduced because they just want to get it over with.
Yes.
You know.
And as a new practitioner, that will be your job to really tune into that. How much you as the practitioner don't want to thoroughly test because, oh goody, he's done. Let's go. We're done. We're done. And you saw there was more. There was more, there was more, there was more. And you're doing a disservice to yourself, your reputation, as well as to the person that's honoring you by presenting this to be worked on, to leave them hanging and to send them out the door when they're still pretty high and you haven't thoroughly tested the work.
And, I mean, aside from the fact I think there's pressure to say I feel better because you want to get it over with, and especially when you're up in front of a group.
Yes.
It's like, get this over with, got it.
Yeah, but I'm known for that, right? In my trainings, I'm known for it. People want to get up and no.
But
We
then,
need to keep testing and making sure.
then there is the other part of it is not really knowing, you know. I think the low, medium, high intensity is perhaps easier than giving it a number for many people.
Yeah, so go with that.
Yeah.
Definitely go with that. And sometimes, he couldn't answer, and so I was doing a little bit of chasing the pain.
Yeah.
You know, the body sensation.
Yeah.
Don't even care what the emotion is or what the trigger is. Let's just work with what's happening in the body.
Yeah, I was wondering about that because I could tell he felt sad, you know.
Yeah.
Who wouldn't?
Right, but again, there's a level that goes to the dysfunctional end, right? There's sadness, of course there's sadness, but then there's that deep, like grief charge, all that, you know, information that's locked in the trauma capsule about it that prevents him from integrating the experience into his life and being okay and healed and moving on.
Thank you.
Yeah, there's a difference. Yeah, Dennis.
At one point you says, I'm right here with you. Keep tapping, you're doing fine. Tell us why you use that phrase.
Yes, because what may be happening when someone is working on an intense experience or trauma is that they're time traveling, right? They're going back in time. They're there. Their mind is already there, back at the event, or in the case of a phobia, they're projecting out into the future. They're thinking about that. But here in the present moment, in this space, with all these wonderful people, we know we're safe. He knows he's safe if he knows he's in this room, and there's nothing to be afraid of. There isn't, you know, there aren't body parts here. So just bringing them into that awareness of, I'm here, it's safe, you're safe right here, open your eyes, that's another thing to watch for. It's like, make sure they know where they are. They're in this time-space reality, they're here. And once they get that, it'll go down, the intensity will go down. Okay, Yanni.
When you worked with me, I think a couple of years ago,
Yes.
one of the things that impressed me about EFT was that I was able to talk to you on levels that I never talked to anybody before. And I saw that in Jim too. That his trust, he was able to, well, he mentioned it, he was completely able to open a beautiful thing about EFT.
Yeah, so I worked with Arnie a few years ago on an event that he had in Korea. And Arnie was just saying that he talked about some things that on a level that, you know, he hadn't. And one of the ways that you're able to do that as a practitioner is you've got to get yourself out of the way and get all of your triggers out of the way and really work on yourself. Really work on yourself. You've got to be that sheet of glass. You've got to be completely neutral. If I had given him any indication that it wasn't okay, that I was being triggered by what he was saying, it would have shut that door on rapport immediately. Yes? So get to the point where it's neutral, coming at you. Things are, sure, if I have an experience of hearing something that's very graphic, and it hasn't happened in a really long time because I have worked on myself I lost track of how many hours, but and worked with different coaches to make sure that I'm completely clear. But a few years ago, I had worked with someone with a ritual abuse, and I was going to sleep at night. This was about four years ago. I'm going to sleep at night, I close my eyes, and a very graphic, vivid image pops into my head about the session I had done, and I immediately turned over and said, Craig, I need to tap. So I just got up and I tapped on that image, and that was it. So that's the beauty of this work, you know? It really is. Really is. Yes?
Just want to ask this. The title is the movie technique, right? When you ask them to do
Both.
the title, but then it's both, you see, you do a title for movie and story.
Exactly.
Oh, okay.
Tell the story and movie technique. You always check and tap and do the title and tap on the title and make sure that the title is neutral enough. Yes, because the title could already be opening up that trauma capsule. If his title had been Body Parts Movie, it would have been re-traumatizing for sure. So 1 minute Guam movie worked great. It was pretty neutral and we could get that down. But yes, tell the story and the movie technique both start with that same way. Check how long that event lasted. Don't have them tell you anything about it. Create a title. Tap on the title until it's a 2, 1, or a 0, and then it's safe to proceed and start at a neutral point, and they tell you, and that's the difference. Tell the story is they're telling you. Movies is that they're not telling you. They're going, oh yeah. That's all. It's all silently in their mind. The problem with that is you really don't know the aspects, the different things that are going on, you know, beneath the surface that you can't catch. It's a lot trickier to do movie than tell the story.
And I know you stopped because that, at a 3 because that's what was appropriate and so forth. So you usually always try to get it down to a 0?
I try. Yes. Yeah. Rarely, I never let anyone out of my office that's, you know, I can't remember the last time I let someone go at a 3, actually. James, you got lucky. You got lucky there. Yeah. So, but I do have a couple of clients that they're the way that they their bodies process this work. We've just realized that they will never ever get to a 0, no matter what we do in session. What ends up happening is I send them home and say, check on it tomorrow morning, and then it's a 0. Right. So they'll say, it's a 1, no, it's a 1, it's a 1. Okay, go to bed, check on it tomorrow, and sure enough, they just need that time to integrate. But that's just been a few people that really have that going on.
Me?
Yes. You?
How do you determine, Elena, when it's best to use, I know you like the movie technique, the verbal, but how do you determine when you should do the movie where it's silent?
So quite frankly, I think I've only done the silent version a few times. And it was, once it was because it was a friend of my ex-husband's who didn't want me to know anything about it. And,
Do you kind of go off the client, kind of what they're feeling? and what-
yeah, but again, it's a lot trickier.
Yeah.
It's a lot trickier. So I'm trying to think of the other time that I did it. Yeah, I don't do it very frequently. Rarely. Yes.
Well, I was gonna say, and this probably wouldn't be for most of the people in this room, but if you were working with somebody with multiple severe traumas, and you were just beginning to work with it, and you knew you were in for a long, you know, a number of sessions with somebody, it might be a way to start.
Might be a way to start.
Because they might not be ready to actually talk yet. But
Yeah.
again, not, yeah.
Yeah, and I think I mentioned this. I don't remember where I had a public presentation, and I was just sharing this recently, where I had a vet who called me who said, I've been working using EFT with my therapist for a number of years, and we're not getting anywhere. And I said, well, what do you think is going on? And just, you know, talking to him, it was very clear that he had never actually said anything, that it was always movie. Yeah, always movie. And so I said, I think that's the problem. That's my sneaking suspicion that that might be it. And maybe what you can do is you can tell your therapist that I made that suggestion, and that you could do lots of tapping on your fear of sharing this with him or her. And I never heard, but I think that was probably a good piece of advice. Yeah. Yeah.
What techniques can you give to veterans who are EFT practitioners to not be re-traumatized as they hear the same thing that they've gone through and it triggers them all over the place? What can they do during that session?
During that session,
Yeah.
they keep tapping. So what's great about not tapping on someone is you're tapping on yourself and you're clearing things. But make sure that you write that down for yourself, you circle it or you make a note or star it, knowing that you're going to have to do that work. That you're being triggered because it's unresolved in you. Okay? It's still something that's unhealed in you, and go work with someone on it. Yeah, Marilyn.
Dennis, one time that this happened to me, well, two different answers here. One was that the vet got to 0 on something, and it was very funny in the rapport building, you know, and it was like, oh, we to 0, and I said, yeah, but do you mind if we do one more round on that for me? You know, and then, you know, it was like, oh, yeah, you know, it was just fine. And the other thing is, and Alina demonstrated this very well, there was no necessary rational, hard line thing of how much you test and how far you take it. And even if you go to 0, you can take it another round.
Yes.
And so your recipient may never know whether you're just doing some EFT thing or whether you're doing it for yourself.
Well, I do a lot of tapping under the table where they can't see or squeeze the finger points, you know.
Yeah. Yeah. Good. Good.
If somebody starts by giving a really graphic title, you would
Yes.
say, do you,
Yes, I change it.
okay.
Yeah. So, some color in the room, or a shirt, you know, the clothing that you were wearing that day, or a picture on the wall, or, you know, the day of the week, or try to find something that's going to make it the title much more neutral. Yeah, or else it's just going to get sticky right from the very beginning. Yeah. Yes.
Well, what I noticed that, and I was very moved by this, and at some point I started crying, tapping, and what came up for me was a deep compassion for human beings.
Yes.
And the things that we do.
Yes.
And I didn't really know, you know, when that was happening. It's like if I were working with somebody and that kind of came up. I mean, I guess it's still more to work on with me, but it was there, like I felt such a, I wasn't getting like a personal thing, but maybe it's all personal. I was, you know, do you have any comments on that?
Okay, so the only thing that I might add is that it's very different when you're actually engaged in it. You know, you were observing it.
Yeah, okay.
It's different when you're in that zone.
Okay.
You know, like, you know, you get to a point where you're just completely tuned in.
Yeah.
And then you take it another level where you're tuned in and tracking. Like I saw a child walk in and I was like, hello, somebody get that child out. And I noticed that some people, you know, so again, it's being that clear sheet of glass, nothing, you know, you've got nothing except just a stable, solid presence for the person that you're working with, and you're completely here. And that comes through doing a lot of work on yourself and the things that you need to heal in yourself.
So what you're saying is more triggering to be watching this than, I mean, I never really thought about that.
Yes, and so, yeah.
Who's doing this?
Yeah, no, you know, Dr. Robert Scare talks about that a lot, that he says the reason for the high degree of burnout in the mental health care profession is not because of the traumatic things that they keep hearing, it's because the traumatic things that they keep hearing in session are really triggering old events that haven't been resolved in the therapists. So, yeah. Yes?
Melina, you said that working with a vet that had war trauma is much easier than working with a vet who had some developmental
Yes.
thing happen.
Yeah, so it's just fascinating to me that some of the easiest sessions I've ever done, and conversely some of the most challenging ones I've ever done, have been with vets in both situations. And what makes the difference is complex developmental trauma. Hard, super hard, lots and lots and lots and lots and lots and lots of layers. And
I mean, issues from childhood?
Yes, a lot. Abuse. You know, that makes it very challenging. And so, repetitive.
Environmental, long-term.
Yes.
Events are one thing, but
Right.
lifestyles.
Right. So as you do this work, know the level that you're at. Don't go where you shouldn't go. But I also say be prepared for stepping on a landmine. You know, chasing the pain. I was doing a demo in a yoga studio, and someone just wanted to work on their shoulder pain, and it triggered, you know, a very traumatic event. And I've had someone in a workshop working on a sugar craving, working on a piece of cake, and suddenly they're back in childhood. So I want you to be prepared. Again, I'm not trying to scare you. I just want you to be prepared and know and absolutely join forces with real professionals and tell them what you're doing in your community so that they can support you and you can refer, please. All right. Excellent. Yes.
If in your heart of hearts, in your vision of visions, if you were to see EFT accepted
Yes.
By the Veterans Administration, where would it come in the process?
Where would it come in the process?
Yeah, where would you see it fitting in?
Oh, I had the joy of being part of a film project in Israel last year where I walked down the street in this little village in Svat during lunch breaks, and I would go into a little gallery, a little shop, and they'd start up a conversation with me. Where are you from? What are you doing here? And I would say, I'm here doing a film on EFT, and everyone knew what the heck that was. And my friend and colleague, Rabbi Emmanuel Lagomsky, Israel Trauma Care Director, he's been amazing in the way that he's gotten this accepted into the military. Even in the military, they're using EFT. And how he's been there, it's going to just be those seeds again. It's just going to be folks like you sending it out, and I think that I